Now, one misconception I'm going to cover today, then we will hold the rest of them for the next week session, uh, because there are many misconceptions. I already talked about the oxygen, oxygen, carbon dioxide, and all that. So, now, one more thing about carbon dioxide, by the way. Carbon dioxide is also a component to build, like for example, it builds the protein and it helps something, to build the system. Carbon is important. So to form the protein and all, but it's another cycle. We don't have to worry about that. That's metabolism. So second part that we talk about now is the deep versus what is a deep breath, belly breath, and full breath. That's the misconception. I want to clarify that part. So everybody will practice this at this point, but I want to show you a deep breath. Why do they call it deep breath? If you imagine a flask, mouth of the flask, and then the flask is like that, okay? And then the mouth of the flask or a container, okay? Which is neck like that, mouth, neck, and like that. That is our body. The airway comes like that, and then the two lungs, like that. You follow? It's like a flask. Now, if you see this, so that's the flask like that. In the flask, what is the deep part? This is the deep part. The base of the lungs is the deep part. And the shallow part is up here. Shallow is up here. So shallow versus deep. Shallow breath, deep breath. It's all in the chest. It's not a belly, okay? We keep talking about belly breath, but think about that. It is actually, air is not going to the belly, air is going to the chest. So think about that, just clear that idea. Now, why do we then call it as a belly breath or a deep breathing? Deep breathing is when there are two things needed. One is the diaphragm. The diaphragm is like a dome like this, which is the big, huge muscle separating the chest and the belly. And diaphragm moves up and down in order to expand. When the diaphragm is like a dome, like a tent, and the tent moves down like this, it creates more space in the chest, negative pressure and all that, and air can come in. When it goes up, it expels the air. So that's simple, that's one. So second is the chest muscles. There are ribs there, and between the ribs there are muscles. So that ribs also open up and allow the chest to expand. So that's the chest breathing. So there are two different breathings. Now, let us practice that so we realize how we think about the challenge. You can all stand up if you want, or sit if you want. Standing will be much easier for you to recognize how it is done. So put a hand on the chest, put a hand on the belly. Stand up like that and then do this. Now, let's do this. Hold the belly tight and just inhale to the chest. Try to expand the chest. Keep your mouth closed. Nose, try to expand. You find it very tough, isn't it? Because this is a bony cage. This is the chest breathing and shallow breathing. And typically what happens is majority of people breathe when they're anxious or something. This thing starts moving and faster. That's shallow breathing. Now, shallow breathing comes only like that much of lung, 1/3 of the top of the lungs. 2/3 is the base. 2/3 is the base. So now, hold the chest and inhale. Relax so that the belly comes out. Inhale and exhale. How easy it is. Much easier than the chest, isn't it? And that's because the diaphragm is moving down. This is all soft intestine area. It can move down. It can push away the intestine and everything, and belly can expand. Now, one question I have. Can the diaphragm move and the belly come out without expanding the base of the lung? Yes. For example, if I just relax, don't let the chest move much, and just protrude the belly. Inhale and exhale, but just protrude the belly. The belly muscles can be independent of the chest muscle. Try that again. So how do you check? How do you check the base of the lung? Hold your hands like this in front of you. You may put it on the lower ribs if you want to put it on the lower chest. And expand. Inhale. The chest is expanding on the side. The arms are going out. This lower cage is expanding. Exhale. The arms are coming near. I can show it this way. In front, I'll hold my hand like this. Inhale. Open up the side of the arms like that. Exhale. Inhale. Belly also comes out, but this lower chest also comes out. If you hold the lower chest like this hand, it might also be exactly easier. Inhale. The two tips of the fingers, they go away as you expand. Now, the three-dimensional expansion. Sideways, forward and backward, and upward and downward. 3 dimensions expansion. That is called diaphragmatic breath. Deep breath is sometimes used the word deep. We call it diaphragmatic breath when the lower chest expands. That's very crucial to think about. So just the belly coming out is not enough. This is important. This lower cage, rib cage, is extremely important. And that is the way to check it. Now, last point I'm going to do before we end this is called full breath. Now, full breath is when the bases are also open, get more air, and also the upper part of the chest. So we'll divide the chest into 3 parts. Base, middle, and upper. 3 parts. So, put your hands here. You will just experience it so that, and you follow with me as I breathe. You follow with my hands and exactly how we are going to breathe. So, inhale slowly, get the belly come out. Get your hands on the side here. Expand the chest, side chest again. Go up here. Expand a little bit more, middle section. Raise your hand up. Expand the upper section. Get the arms out. Inhale. Look up and smile. And exhale. This is a full breath. So what happens is, inhale, belly comes out, the diaphragm moves down. The side wall comes the second step. Third wall is here, third is here. As you get your arms out here, the ribs open up on the side. When you go throw the arms out here, the shoulder blades move out. Shoulder blades move out like that. And it creates more space. The collarbones go up. So all the upper part of the lung also start filling up. And then after that, when you do that, look up. Now, when you look up, you'll have air coming in with less resistance and can come in. If you have your neck bent like that and inhale and exhale, you will see the difference. When you do this, people, when they put the breathing tube with the anesthesia doctor, they put it like that. And then smile. Smile always increases the blood, airway coming in. We'll talk about that in the next section. Thank you.